morning, everyone. My name is Lodica Wallace, and I am a Doctorate of Nurse Practitioner student at the University of Michigan-Flint. I have been a nurse for 10 years, and I currently work at St. John Providence Hospital in Southfield. Today, I will be going over cultural competence. And when I say cultural competence, it's basically, have we ever thought about the care that we give a patient depends solely on their culture? So say, for instance, we can give a patient the appropriate meds at the appropriate time, or we can follow the doctor's prescriptions to a T. But if we are not making our care culturally specific, are we actually giving care to that person? And that is what I'm here to talk to you about today. So the objective of my presentation will be to go over the overview of the theory of cultural care diversity and universality, to discuss the steps toward becoming culturally competent, to use two sets of nursing practices, generic and professional skills, to guide our nursing goals and actions, and to understand and apply Leininger's 3 cultural care modes of decision and actions, and to incorporate that into our nursing care practice. So the history of transcultural nursing starts with a woman by the name of Dr. Madeline Leininger. She was a registered nurse who worked as a clinical mental health specialist. And she worked with children of various cultural backgrounds. And what she noticed when she was working was that the care that the nurses and the other healthcare professionals, it was missing something. The care that these professionals were giving these children, it just missed something. Some component was missing, and she didn't know exactly what it was. Next. So as she continued to just observe these interactions, she came to the conclusion that culture and care were interconnected. That depending, once again, on these children's cultural background, how the nurses and the other healthcare professionals, how they interacted with these children, determined if they were going to have a healthy outcome. Unfortunately, Dr. Leininger didn't have any research to back her theory. There are no journals written. There was no one in the healthcare profession really that could support her in her theory. So what she did was, she decided to get a PhD in anthropology, and she decided to study this further. She envisioned that this new field of study called transcultural nursing, and she proclaimed that care was essential for nursing. And as she studied in around the 1960s, she decided to take her research a little bit further. She decided to go to New Guinea and stay with a group of villagers. She stayed with them for 2 years, and she interacted with these people. She got to know them. She got to see the different aspects of their culture. And from that, that's when transcultural nursing really expanded. She started to get backing. People started to really listen to her and see what she was talking about. And during the 1970s and 80s, when people were really, like I said, listening and starting to support her in her theory, then Transcultural Nursing Society was established. People were starting to write journals about this theory, and textbooks were even started to be written. Next. Which brings me here today. Like I said, I am a Doctorate of Nurse Practitioner student, and during our course of studies for most nursing students, we have to take some type of course in transcultural nursing. We have to be culturally competent and understand that we are coming into contact with people of various cultural backgrounds. And actually, for hospitals and different organizations to be accredited, a lot of the employers also have to be have some type of formal training in transcultural nursing. And sometimes you would even hear businesses that are not even related to healthcare say, oh, I had to have some type of sensitivity training. The person here to my right is Dr. Marilyn McFarland, and she's actually my instructor, along with Dr. Marilyn Eickerle, who's not shown here. But Dr. Marilyn McFarland and Dr. Wibby Alama wrote a book called Culture, Care, Diversity, and Universality, and that is the book from which I study from today. Next. So to get into the culture care theory, I first want you to just think about, what does culture mean to you and what does care mean to you? And I ask you this question because these, like I said, are the two main components of Dr. Leininger's theory. So when one hears culture, it's basically a set of beliefs and values that are shared from one culture, from generation to generation in that culture, and it guides our actions and our thinking and the way we just perceive the world. Care, on the other hand, has to do with those abstract actions and our practices that help people gain a sense of well-being. It helps them sort of transition into sickness or illness, or transition out of that, and helps them deal with disabilities and even transition into death. Next. So the purpose of Dr. Madeline Leininger's theory was to discover and document how culture and care are interconnected, and how that shapes the similarities and differences in people's cultures and their values and beliefs. And the goal is then to take that knowledge and to provide culturally specific care. But before she really got into the theory, she said there were some assumptive premises, some things you have to think about before you can really get into the theory itself. What she first said is that care is the essence and unifying focus of nursing. In order to do nursing, you have to come with some type of caring aspect. Caring is essential for human growth, well-being, and survival. Like I said, it helps people face death and disabilities. Care is also essential for curing and healing. Without care, you cannot cure a person or heal a person, but without culturally specific care, you can care for a person, but they don't necessarily have to be healed or cured. And there are two types of care practices that she spoke about and that she said were needed for healthcare professionals. And that's generic care, and that's the folk remedies and things like that that were passed down from your grandmother when you feel sick. These are the type of things that you turn to. And also professional care. And professional care is the type of care that we learn in school, like how to take blood pressures and, read diagnostic testing. And also the last assumptive premise is culture care values and a person's culture is influenced by a number of different factors. And here, this is when I get into the sunrise enabler. And the sunrise enabler, basically, when you're trying to find out about a person's culture and you want to know what influences them, how do you do that? How do you start off this learning process when someone is sitting before you and you are unsure about what they consider caring or what they consider important? So Dr. Madeline Leininger developed the sunrise enabler. And I have a copy on the desk if anyone wants to look at it, because I know it's a little bit blurry up here, but she developed this enabler, and it first starts off with a person's worldview. And basically, a person has this overall perspective of the world and how they view the world. And a person's worldview is basically influenced by what we call language and environmental factors. And these environmental factors and languages range from kinship, like how a person interacts with the members of their family. It also involves economic factors, legal and political factors, education. And just a quick example, one that's of course in the news right now, is the case of the police officer Darren Wilson, and how that whole aspect right now is changing these people in Ferguson's, their worldview and how they see the world and how they see politics and how they see, their interactions now with the people in their community. All of these influences from language and environmental factors goes to shape how, like I said, a person views their community, how organizations interact, And thus, that also has an impact on healthcare and how we as healthcare professionals, given everything that a person has gone through and has been exposed to, it then shapes the way we have to practice, like I said, in our professional viewpoints and our generic viewpoints. And from these two, these generic and professional nursing skills, it thus shapes our actions for these three modes of healthcare actions that Dr. Madeline Leininger have developed, and I will go into these just a little bit later too. It's called the three transcultural modes of healthcare and action. Next. So when someone first stands in front of you and you want to get to know them, the first thing you can do, like I said, you can take the Sunrise Enabler and you can just have a series of open-ended questions with them. You can start off with their worldview and ask them, are there any views or beliefs that maybe your parents passed down to you that gives you a greater perspective of the world? How do you view the world? And when you start off having this conversation, these open-ended questions, you will then get a bigger picture and a broader picture of the person standing in front of you. You can then ask them, you can go down the list and ask them about their cultural values and life ways. Like, what values or practices do you have that maintains a healthy life way, you know, a healthy view in your community? What is it about your culture that you think contributes to your health? And like I said, if you continue to ask a person using the Sunrise Enabler, you continue to ask them questions, you will get an overall picture of what's important for this person and how to care for this person. So I had to, one of my assignments in class was to interview a person from a different culture than mine. And I asked a person, he was from the Bangladesh community, and I used the Sunrise Enabler, and I, was asking and questioning this person about their culture. And what I found that one of the most important aspects of the Bangladesh community was their religion. He follows the Muslim faith, and for him, the Muslim religion basically dictates everything about his culture, the way he eats, his prayer time, his interaction with his family. So, like I said, the Sunrise Enabler allowed me to get to know this person and get to know his culture a little bit better. So when you have this knowledge, when you have then, looked into all the factors that are deemed important to this person, you can then begin your cultural assessment. And there are steps to becoming culturally competent. You just can't then go and assess the person. So as this paragraph that I found in our book, it said we must have a change in mindset from viewing how clients can fit into the nurse's world and way of doing things to examining how nurses may understand and fit into the patient's world, thus changing the nurse's practice. We as nurses must break out of the mindset into thinking that we are doing patients a favor, that they're in the hospital or in our office and we're caring for them, so we're doing them a favor. So they need to do everything that we say. We must break away from that, and we must develop skills and knowledge to step into these patients' shoes, to step into their culture, and to understand all the various things that goes into caring for them. And that right there is the most important thing. So the first step in our cultural assessment is to get to know yourself. It's to think about your own culture and your own background. And we have to understand, and maybe we don't always want to admit it, but when we have our first encounter with a person, we already have prejudices and biases when it comes to different groups of people. And we need to reflect on that. We need to accept that we do have these prejudices and these way of viewing people, and we have to find ways to get over that. We need to reflect on the care that we have given patients before and look at things that we could have done differently. Was there something that I could have changed based on this person's background or based on what I perceived this person to be? The second step in our assessment is to become culturally sensitive and have some type of holding knowledge. When a person comes onto your unit or to our unit, we have to know the background of the patient. We have to do a little bit of research on these groups of people. Once again, we can take the Sunrise Enabler and ask these people questions on what it is in their background that's important to them. And one of the most important things is to also use culturally sensitive language. That is so important. The tone, which is the first thing a person's going to hear out of your mouth, is so important to be sensitive to people. Our nonverbal language also is very important. I mean, we can give people eye contact, direct eye contact, and in some cultures, that's actually offensive. So we have to understand that verbal and nonverbal cues are also important to different groups of people. And we also have to avoid stereotyping. Next. The third step into becoming culturally, in our cultural assessment, is to become culturally competent. You can then take all of this knowledge that you know and hence adapt your behavior. So say, for instance, an Arabic woman comes into our unit. My past experience is that Arabic women feel very uncomfortable with having a male nurse or a male nursing assistant or patient care tech. So let's just say I was in charge that day, and I know the next patient we're going to get is an Arabic woman. And let's just say the next person that's supposed to get a patient is the male nurse on the unit. Well, I have to change and adapt my behavior and my learning processes to understand that, you know, this, if I assign this male nurse to this woman here, to this patient here, I'm going against her religion and against how she feels, how her culture feels. And I must adapt to our unit, adapt our assignment to fit this person's cultural belief. So like I said, after you've done your cultural assessment, after you know all the influences that goes into making, like I said, a culture different and more specific than your own, you can then go into adapting your professional healthcare practices. And like I said, Dr. Leininger said that there are two types of nursing practices and skills, and that's our professional and generic care practices. So like I said, professional healthcare practices are those that are learned through formal training. It focuses on diagnosing a person, treating a person, and preventing their illness. It's like I said, taking blood pressures or teaching a person based on their disease process and going over the tests that they just may have come back from. So one of the things when you're shaping your professional care practices is, once again, look at your culture and compare it to the culture of the person that you're taking care of. So when I did my interview on my coworker, like I said, who's from the Bangladesh community, one of the things that I found that we have in common, if ever we came into the hospital, is that respect is very important. We want doctors and other healthcare professionals to talk to us, you know, in a respectful manner, not to talk over our heads, to sit down and listen to what we have to say. And also that family involvement for both of our communities is very important. For the Bangladesh community, the males usually make most of the decisions. So you could have a female person from this community come into the hospital, and she may have female family members come with her, but she may also have a lot of male family members come with her, and those will be the people making her decision. So when you're shaping your healthcare practice around someone from the Bangladesh community, you also have to make sure that you speak with the males in her family just as much as you speak with her. However, for the African American community, it's not necessarily as much as the male dominating force in our community, but we also have a lot of family involvement. And family we can see as church members. We have a lot of church members come to the floor and are very involved in that person's care and deem themselves just as important as their brother and sister. And we also come with a lot of people, you know, in our family usually follows us up on the unit. So when you're taking care of someone in the African American community, you have to keep in the back of your mind that they may come up with a lot of family members. You may have a lot of questions that you have to deal with. And like I said, they all may not be from their immediate family, but people from their community who find themselves just as important as, you know, a brother or sister, or mother and father. So then we switch to generic care practices. And like I said, these are the learned and indigenous knowledge and skills that are passed down from generation to generation. And remedies are usually the primary focus when it comes to generic care practices. So once again, when I did my assessment on my coworker, I found that they really have no generic care practices. If they get sick, the first thing they want to do is go to the hospital. That's they believe in modern medicine. However, when I looked at my culture, generic care is very important to us. For me, I will call my mom and ask her, oh, Mom, I'm sick. What is it that I can do, you know, to make me feel better, instead of making an appointment for my doctor. Or I'm the type of person that goes to GNC and trying to find the best supplement for whatever is ailing me, instead of, like I said, calling and making an appointment. So for the African American community, this is our first approach when we are ill. So like I said, if you're taking care of someone from the African American community, you have to put in back of your mind that there is a generic care component, whereas someone from the Bangladesh community, you can sort of X that out in your care practice. Next. So once again, now that you have your skills down set, it's now time to put your practice into action. And Dr. Madeline Leininger developed 3 modes of nursing healthcare decisions and actions. And the first step, the first mode that she developed, is what's called preservation and maintenance. And preservation is just keeping whatever healthcare patterns and practices these people have in place. If it has been working for them and it has not harmed them in any way, we want to preserve this patient's culture as much as we can. And as far as maintenance is concerned, if they're unable to preserve their culture in any kind of way, we step in and help them do that. So as an example, actually yesterday, I had a patient, a Jewish patient, and I know that Jewish people, their diet consists of is a kosher diet. Now, we don't necessarily keep kosher menus on our unit, and that's not the first type of diet that we give people. However, in order to preserve his way of living, I had to call downstairs and make sure that this patient was supplied for every meal a kosher diet. And sometimes we get Muslim patients on our unit. And like I said, religion is very important for them. So I had to allow time and maintain them to maintain their religion on our unit. So I have to give them time to pray. And if I don't know the direction of prayer, because that's also very important, I have to figure out what's north, south, east, and west for them in case they don't know. Next. The second mode in Dr. Leininger's nursing healthcare decisions and actions is accommodation and negotiation. Accommodation is modifying some approach to our healthcare practice. And negotiation is compromising, getting together with the patient and compromising on some idea or some form of healthcare to meet their needs. So once again, if I got a patient from the Muslim religion and it is during the Ramadan season, I may come first thing in the morning and think that I'm able to give them their medication. However, between sunup and sundown, they don't take in liquids or anything else. So I need to modify my nursing actions to bring, their pills or whatever else they need to take orally after sunset, during the time in which they can eat. And say if I had a patient that came back from surgery, and we all know how nutrition is very important for these people to heal, but a patient is very adamant, I hate this food here, I'm not eating this food here, I don't want it. So yes, at that point I can negotiate with their family. Yes, your family can bring in food. However, it has to be just as healthy as the food that we're serving here. So we can negotiate and we can get around you, not wanting to take the food in here, but it has to be just as healthy as what we would serve you here. Next. And the last mode of nursing and healthcare decisions and actions is repatterning and restructuring. Repatterning is just doing something different to preserve the pattern, but changing the structure for a better outcome. And restructuring is just altering an unsafe behavior altogether. So say in regards to repatterning, I have a patient that I have to do some teaching to. They're going home and I need to teach them about, say, congestive heart failure. This person may not be able to read at all. So I have to restructure or repattern the way in which I teach this person. So instead of handing them a handful of pamphlets to read, I may roll in our video and pop a video in on their disease process and teach them the different ways to keep themselves healthy at home. And restructuring is, say, a lot of cultures depend on herbal use, some type of teas or supplements that they take every day at home. But some medications, it can interact, it can have a very bad contraindication. So say if I sent a patient home on Coumadin, a blood thinner, I know that foods that are high in vitamin K is contraindicated or has to be taken at a very low dose. So I need to restructure these people on their diet habits and how not to take in as much food or as much foods that are high in vitamin K as what they were used to taking in. So to just reflect on what we have gone over today, just know that the world is very diverse. And although you may not come in contact with every culture out there, you will come in contact with a group of these people. And we have to know for ourselves, we have to look within ourselves to see our prejudices and how to overcome those things. We have to learn how to restructure our nursing care patterns to provide culturally specific care for these people. And only then will we say that we actually gave care to a person, when we restructure the way that we think and put a person's culture first. And I like this little quote here, that learning without reflection is a waste. However, reflection without learning is also dangerous. So I want to thank everyone for their time. And if you have any questions, you can post them now. Thank you, but I wanted to thank everyone for their time. Any questions?